Welcome to the enrollment for our benefit plans. The plan year is April 1st through March 31st. Each year prior to April 1st, you will have the opportunity to make changes to your benefits during our annual open enrollment. New employees are eligible for benefits on the first day of the month following your date of hire, with the exception of our 401k and ESOP. Benefits are available to full-time and regular part-time employees and their dependents. Our health insurance is with Florida Blue. We offer a telemedicine benefit through Teladoc, which includes services for non-emergent illnesses, dermatology, and counseling. If you enroll in the high-deductible health plan, we offer a health savings account through Optum Bank. Our dental and vision insurance plans are with MetLife. The life and disability coverages are with New York Life. We offer medical care and dependent care flexible spending accounts with iSolved Benefit Services. Our employee assistance program is administered by TELUS Health. We offer pet insurance through Nationwide and voluntary accident, critical illness, and hospital plans through MetLife. Additionally, we offer 401k and ESOP plans. You also have access to an online discount marketplace called Perks Plus, where you can find discounts on various services and items. You will enroll for your benefits in our online enrollment system, BenExpress. Our benefits guide provides details about all of the coverages offered to you, including eligibility, benefit summaries, and cost per pay period. Contact information for all of our insurance carriers and benefits consultants at Highland is also included in the guide. Be sure to review this guide before making your elections. Complete your benefit selections in BenExpress. You can log into the site from any computer with your username and password using the format shown here. Your personal information will be loaded in the system, but please review and update your contact information, family member information, and life insurance beneficiaries. BenExpress will guide you through each benefit plan for you to make your elections. When you are finished, save or print a copy of your confirmation statement for your records. If you elect a life insurance coverage that requires an evidence of insurability form, you will be prompted to print the form found in the Resources tab. Please print the form and submit it to Human Resources. We offer 2 health plan options with Florida Blue, a copay plan and a high-deductible HSA plan. Both plans cover services received from network and non-network providers. However, services received from non-network providers will be subject to a separate and higher deductible and coinsurance amounts. Your medical plan deductible will start over on April 1st. Our health plans with Florida Blue cover in-network preventive care at 100%. No deductible or copay applies. This includes coverage for annual physical exams, annual well woman, well man, and well child exams, lab work associated with an annual exam, flu shots, mammograms, and prostate exams, just to name a few. In the high-deductible plan, you pay the cost of all non-preventive medical services, including prescription drugs, until you have met the plan year deductible of $1,600 for single coverage and $3,200 if you cover dependents. In a family plan, the full $3,200 deductible must be met before coinsurance coverage begins. The amount you pay for services and prescriptions is based on the contracted rate that your doctor or pharmacy has with Florida Blue. After you meet the deductible, you pay copays for prescription drugs and 20% coinsurance for in-network medical services until you meet the out-of-pocket maximum of $5,000. The out-of-pocket maximum includes the deductible, coinsurance, and prescription drug copays. After you've met your out-of-pocket maximum, Florida Blue will pay 100% of eligible in-network services for the remainder of the plan year. The copay plan offers copays for physician office visits, urgent care and emergency room visits, major diagnostic testing, hospitalization, outpatient surgery, and prescription drugs. All other medical services are subject to a $500 deductible per person to a $1,500 family maximum. After you meet the annual deductible, Florida Blue will pay 80% of covered in-network services, and you will pay 20% until you meet the out-of-pocket maximum of $2,500 per person or $5,000 if you cover dependents. After you've met your out-of-pocket maximum, Florida Blue will pay 100% of eligible in-network services for the remainder of the plan year. You can save money on your healthcare costs by doing things such as using your primary care doctor or Teladoc for non-emergent illnesses versus going to the ER, using a standalone facility instead of a hospital for an outpatient surgery or diagnostic scan such as X-ray or MRI, can save you up to half the cost for these services. When possible, ask for generic medications to save on your out-of-pocket costs. At some pharmacies, you can get generic prescriptions for $4 without using your insurance card, and some offer certain generic medications or antibiotics for free. We encourage you to use generic medications because they cost less in deductible or copay amounts and help us control the cost of our health plan. Mail order prescription drug service is also available with Florida Blue through the Amazon Home Delivery Pharmacy. To start a prescription on mail order, call the number on the back of your ID card or log into your Florida Blue member account and go to the pharmacy section under My Plan. Once your prescription is set up, you can manage it through your Florida Blue online member account. With this program, you receive a 90-day supply of maintenance medications and you pay 2.5 monthly copays for 3 months of medication. It is delivered right to your door. Our high deductible plan is combined with a health savings account with Optum Bank. You can start, stop, or change your HSA contributions anytime during the year by completing the HSA form found in the source and returning it to HR. The HSA is your personal bank account that is used to set aside tax-free money to pay for medical, dental, or vision expenses for you or your dependents. You may also purchase over-the-counter medical supplies and over-the-counter medications using your HSA money. Use your Optum Bank debit card to pay for expenses out of your health savings account. Once money is deposited into your account, the balance will always be yours to use for eligible expenses. If you don't use the funds, they will continue to grow year after year. Be sure to take advantage of this opportunity to save money in your HSA. ECT will contribute to your HSA twice per year on a pre-tax basis. If you have single coverage, ECT will contribute $500 in April and again in October. And if you cover dependents, ECT will contribute $700 in April and again in October. Please take note of the maximum amount that may be deposited to your health savings account per calendar year. This maximum includes funding from ECT and your personal funding. You must keep receipts for expenses you pay for with your HSA because this is an IRS auditable account. Purchases made for ineligible expenses will be subject to a tax penalty. If you are enrolled in Medicare, TRICARE, a medical flexible spending account through your employer or your spouse's employer, or enrolled in other coverage that is not a high deductible health plan, you are not eligible to contribute to a health savings account. Please notify Human Resources if this applies to you. We offer a telemedicine service with Teladoc that allows you to have a virtual visit by phone or video with a licensed physician at any time from anywhere. The best part is, the cost of the visit is free. Through Teladoc, you will discuss your symptoms, and the doctor can diagnose and treat a wide range of non-emergent medical conditions, and even call in a prescription. You pay for the prescription according to your medical plan benefits. Our Teladoc program also gives you the opportunity to have a consult with a dermatologist by sending images of your skin condition, and the doctor will review the images and provide a response through your Teladoc account and write a prescription as needed. Taking care of your mental health is an important part of your overall well-being. Our Teladoc program gives you the opportunity to have a phone or video visit with a therapist. You can make an appointment 7 days a week from 7 a.m. to 9 p.m. local time. Teladoc is especially convenient for those times you want to speak with a doctor in the comfort and privacy of your own home, or if you are traveling out of town, and even when your primary care doctor does not have any openings. If you enroll in one of ECT's Florida Blue medical plans, Teladoc is automatically included. Due to COVID, the CARES Act that is temporarily in place currently allows us to offer all Teladoc services to you and your covered family members at no cost. We encourage you to register and set up your Teladoc account when you become eligible for coverage, to make it quick and easy to talk to a doctor when you need it. Your spouse and children over age 18 must create their own account. Enter your Florida Blue member information from your ID card when registering. Our benefit program includes convenient online tools that should be utilized. Register for an account at floridablue.com to view your processed claims and copies of explanation of benefits. You can also find a network doctor or hospital, compare treatment costs, and more. Employees living outside of Florida can easily find network providers online at provider.bcbs.com. Enter the prefix XJB when prompted. Florida Blue also provides a mobile app, so you can conveniently access your ID card, review your benefit and claim information, find network providers, manage your prescriptions, and more. Our dental insurance is with MetLife and includes orthodontia coverage for children up to age 19. Our plan covers services received from PDP plus network dentists and non-network dentists. By utilizing network providers, you will receive the highest level of benefit and save on out-of-pocket costs. Non-network dentists may balance bill you for the amounts not paid by MetLife. For this reason, we encourage you to use network providers as much as possible so you can save on your out-of-pocket costs. The dental plan covers preventive services such as cleanings and x-rays at 100%. The deductible does not apply. For basic and major services, you pay a $50 deductible per person, up to a $150 family maximum. After the deductible, basic services such as fillings and periodontics are covered at 80%, and major services such as crowns and bridges are covered at 50%, up to a maximum of $1,000 per covered person per plan year. The plan covers orthodontia for children up to age 19 at 50% to a lifetime maximum of $1,000 per covered child. Please remember to have your dentist submit a pre-authorization request to MetLife for any basic and major services prior to having the procedures done, to ensure the services are covered and to estimate insurance payment and your estimated out-of-pocket expenses. Our vision plan with MetLife uses the Superior Vision Network. If you use a network provider, you will pay a $10 copay for a routine eye exam once every 12 months. Once every 24 months, you may purchase frames and the plan will cover the cost up to $130, plus you get 20% off the balance. Lenses are available for a $10 copay once every 12 months. If you choose contact lenses in lieu of glasses, the plan will cover the cost of contacts up to $130 once every 12 months. If you choose contact lenses, you will not be eligible to also receive benefits for lenses and frames in the same 12 months. If your vision provider is not in the network, you will pay for your services upfront and file the claim with MetLife for reimbursement. In-network providers can be found at www.metlife.com. Select Find a Vision Provider, then choose the Superior Vision by MetLife Network option. MetLife does not mail dental or vision ID cards, but the good news is your provider can still see you without a card. Tell them you are a MetLife member and provide your Social Security number. MetLife provides online access to your dental and vision plans, where you can download your ID card, view your benefits and claim information, find local network providers, and more. MetLife also offers a mobile app, which gives you convenient access to view your dental ID card, view your plan details, find a network dental or vision provider, and more. ECT provides all benefit-eligible employees with base life and accidental death and dismemberment insurance, equal to 1 times your annual base pay to a maximum of $50,000. ECT pays the entire cost for this coverage. All eligible employees have the opportunity to purchase voluntary life insurance through New York Life. You may purchase coverage on yourself in $10,000 increments, up to $260,000. You may purchase life insurance in $5,000 increments on your spouse, up to $100,000, and you may purchase $10,000 of coverage for your dependent children. As a new hire, you can enroll in new coverage or increase your current coverage up to the guarantee issue amounts without having to submit an evidence of insurability. If you elect an amount over guarantee issue, or you are electing new or increased coverage during open enrollment, you will need to complete an evidence of insurability form and submit it to Susan in Human Resources, who will forward it to New York Life for approval. ECT provides all benefit-eligible employees with short-term and long-term disability insurance with New York Life at no cost. These coverages protect your income in the event an accident or illness prevents you from working. The short-term disability insurance provides 60% of your weekly income, up to $2,000 per week, and benefit payment begins on the 15th day of disability. The benefit will continue to be paid while you are disabled for up to 90 days. The short-term disability plan does not cover work-related accidents or injuries, but it does cover approved leave for childbirth. There is no pre-existing condition limitation for this coverage. If you are still disabled and unable to work at the end of 90 calendar days, The long-term disability insurance will begin to provide 60% of your monthly earnings to a maximum benefit of $6,000 per month. Benefits may continue for as long as you remain disabled or until you reach your Social Security retirement age. There is a pre-existing condition limitation on the long-term disability. Any condition that existed in the 3 months prior to your coverage effective date will not be covered until you've been covered under the plan for 12 months. Our coverages with New York Life include several valuable services. They include a life assistance program, will preparation services, travel assistance, financial wellness program, and more. See your benefits guide for more details on how to take advantage of these great benefits. You have the option to enroll in 2 flexible spending accounts, a medical care account and a dependent care account. The medical care account allows you to make pre-tax payroll deductions and use this tax-free money to pay for medical, dental, and vision expenses for you or your family members. Carefully estimate how much you will spend during the plan year before making your election. Your annual contribution will be deducted in equal amounts throughout the year, yet you will have access to your entire election on April 1st or on your benefits effective date if you are a new hire. Once you make your annual election, you cannot change it until next open enrollment unless you have a change in family status. If you don't spend your entire election by March 31st, you can roll over up to $560 of unused funds into the next plan year. Any balance over $560 will be forfeited. If you contribute to a house savings account, you cannot also contribute to a medical care flexible spending account. The maximum you can contribute is $2,800. The Dependent Care FSA allows you to set aside up to $5,000 on a tax-free basis to cover daycare expenses for children or for a disabled dependent of any age so you can work. Unlike the Medical Care FSA, funds in the Dependent Care FSA can only be used as they are deposited each pay period. We encourage you to review your personal tax situation, as you cannot use both the Dependent Care Flexible Spending Account and the Dependent Child Care Tax Credit when filing your personal income taxes. Any unused funds will be forfeited if not used in full. There is no rollover amount with the Dependent Care FSA. All employees who have completed 3 months of continuous service and are at least 21 years of age are eligible to participate in our 401k retirement plan with Empower Retirement and Avis. Once you have met the eligibility requirements, you will be automatically enrolled in the plan the next month, and the default enrollment deferral will be set at 4%. You will have the opportunity to make changes to the deferral percentage or to opt out of the plan before the automatic enrollment occurs. You may contribute 1% to 100% of your pay each pay period, up to the IRS annual maximums. ECT will match 20% of the first 5% of your salary deferral contributions. ECT offers a Roth 401k deferral option. You will be able to choose this after-tax option when changing your deferral percentage on the Empower site. For more information about our 401k plan, please refer to your benefits guide. ECT has established an ESOP that allows employees to share in the growth and prosperity of the company. The plan provides participants the opportunity to accumulate capital for their retirement needs at no cost to the employee. To be eligible, you must work a minimum of 1,000 hours within a 12 consecutive month period. Once eligible, you will enter the plan at the next entry date of January 1st or July 1st. Our Employee Assistance Program is administered by TELUS Health. Our EAP is a resource designed to provide support in many areas of your everyday life. You can get assistance with financial questions and issues, work and family life concerns, and even legal support from attorneys. All full-time and regular part-time employees and their families are covered at no cost, and it is completely confidential. Call or log in to TELUS Health anytime you or someone in your family is in need of assistance. We offer pet insurance with Nationwide. The plan has a $250 annual deductible that must be paid before the plan begins paying benefits. You can receive up to $7,500 in annual benefits. You choose a reimbursement level of 50% or 70% for services such as accidents and injuries, illness, surgery, x-rays, and more. You will receive a welcome kit from Nationwide with your policy and rate information, claim filing instructions, and contact information for Nationwide. To enroll in this benefit, you will use the link on the pet insurance page in BenExpress to enroll directly with Nationwide, or you can call 877-738-7874. The voluntary worksite coverages are insured through MetLife. We offer an accident plan, a critical illness plan that includes coverage for cancer, as well as a hospital indemnity plan. You can cover yourself, your spouse, and your children. There are 2 MetLife accident plans to choose from, a high plan and a low plan. The high plan costs a bit more per pay period than the low plan, but pays out higher benefits when an accident occurs. The accident plan pays benefits directly to you and helps pay for expenses associated with an accident, such as deductible or copays, travel expenses, or lost wages. Here are just a few of the benefits our accident plan provides. This coverage is guarantee issue. You do not have to answer medical questions. The critical illness plan pays benefits directly to you in the event that you or a covered family member are diagnosed with a covered illness, such as cancer, heart attack, stroke, kidney failure, and so on. The benefit can be used to help pay for medical expenses, living expenses, or any way you see fit. You choose to receive a benefit of either $15,000 or $30,000, which is payable to you upon diagnosis of a covered illness. If you cover your spouse or children, they are covered at 50% of the employee's benefit amount. There is a wellness screening benefit of $50 per covered person per calendar year, so don't forget to file your claim for getting your annual exams done. This coverage is guarantee issue at open enrollment. You do not have to answer medical questions. There is a pre-existing condition limitation. See your benefits guide for more details. There are 2 hospital indemnity plans for you to choose from with MetLife, a high plan and a low plan. This plan pays a benefit to you in the event that you are admitted into the hospital as a result of an accident or sickness. There is no pre-existing condition limitations for this coverage. You can enroll in this coverage during open enrollment on a guarantee issue basis. There are no medical questions to complete. If you enroll in any of the MetLife voluntary worksite plans, you have additional resources available to you, such as free will preparation services at www.willscenter.com. Lastly, we are excited to offer you Perks Plus, which is an online discount portal where you can get discounts on things such as hotels, rental cars, concert tickets, Disney tickets, gym memberships, and so much more. There's no cost for you to use it. You pay for the items you want to purchase with the discount. All you have to do is click on the QR code with your camera of your phone or go to the website on the page and register using the details here. Then shop around and see what you can find to save money on. We are proud to present this benefits package to our employees. Now it is time for you to take action. Be sure to review the benefits guide and complete your benefits enrollment in Ben Express no later than the deadline given. Remember to use the resources and websites available to you from Florida Blue, MetLife, New York Life, and Optum Bank. Let us know if you have any questions, and thank you for your time.